Hi, I want to thank Wolfgang von Sonnenberg for the opportunity to speak at this beautiful inspiration community. I am health. And I don't use this phrase because I'm a physician who treats patients with cancer, hypertension, and diabetes. I'm not using this phrase because I haven't suffered chronic diseases myself, because I have. I am health has become a personal mantra that I've adopted to remind me of my own intrinsic healing powers, thus being able to take full responsibility for my health. I've learned this lesson from many patients I've witnessed reverse their chronic diseases without the aid of conventional pharmaceuticals and surgeries. I'm Dr. Kien Vuu, and I'm currently an assistant clinical professor of medicine at UCLA. I'm an interventional radiologist by specialty, which is a fancy way of saying I use medical imaging to do minimally invasive procedures. I treat the consequences of many chronic conditions, including diabetes, cancer, hypertension, renal disease, and many others. Chronic disease is an American and global epidemic, and by far the biggest challenge we face in healthcare today. About half the population of Americans have a chronic disease, and 1 in 4 Americans have more than one chronic disease. Chronic disease is responsible for the majority of death in the US. The consequences of chronic disease include destroying our quality of life, shortening our lifespans, bankrupting our governments, and threatening the health of our future generations. In fact, this generation is the first in which children are expected to live shorter lifespans than their parents. I speak of our own power to heal, not from the perspective of a physician who treats chronic disease, but from a patient who once forfeited my own healing power. So, a little backstory about me. Just a few years ago, many from the outside world would look into my life and perceive that I have achieved the American dream. I was a boat refugee that survived dysentery and rickets and came to America penniless and was able to overcome racism and poverty to become a successful doctor. I found myself in private practice as the chief of interventional oncology at my hospital. I had a lucrative career, a fantastic house, a fancy car, and a woman I thought I was going to marry. Then everything in my life started to fall apart. I lost an uncle to cancer. The woman I thought I was going to marry left me for another man. And this doctor who was giving medical advice was suffering from health problems that I created on my own. I was working long hours and taking prescription sleep medications just to sleep every night. I was overweight, diabetic, and exhausted on every level. My story was unraveling, and I was becoming another statistic in America's chronic disease tally. You know, I partly became a physician because I wanted to help people. But the truth of the matter was, I also became a physician to be respected. As a refugee, I oftentimes felt like I was not enough, and the white coat was used to hide this not enoughness I was feeling inside. Not rich enough, not tall enough, not American enough, or not smart enough. I spent my entire life becoming successful in the eyes of others, and it didn't just cost me my relationships, but also my health. I then began a journey of self-healing and personal development, and rediscovered how to be more authentic, more vulnerable, and really starting to own my true power. And during this process, I've come across patients who reverse their diseases without any aid of conventional medicine. Many of these miraculous recoveries occurred with shifts in thought and mindset, with meditation, stress control, diet changes, futuristic biohacking, and then other alternative therapies. What I have discovered is that everyone has the power to radically transform how they look, feel, reverse disease, and to live a long life. The field of epigenetics support the ideas that our choices and lifestyle and how we view the world are actually play a more important role than our genes in determining our health. The truth of the matter is, genes can predispose us to certain diseases. But the good news is that it is gene expression, or what genes get turned on and turned off. Those things are controlled by external factors. And in very simplistic terms, disease states are actually abnormal states in which there's an imbalance of gene expression, not the genes itself. And since gene expression is determined mainly by external factors, by the choices we have, we have complete control over them. Many of these external inputs that affect gene expression include our diet, nutrition, exercise, sleep, but interestingly enough, also our thoughts and emotions and how we view the world. Recent studies have now shown that emotions of love, gratitude, community have positive effects on human health, including better immunity and decreased inflammation. Researchers Stephen Cole from UCLA and Barbara Fredrickson from the University of Illinois have also demonstrated that persons who exhibit something called eudaimonic well-being, and that's the type of happiness or well-being you feel when you have that broad sense of purpose and deep meaning of life, that when those people that demonstrate that have a more favorable gene expression that promotes health and longevity. I don't think my story is unique. Many people in this country and all over the world with chronic disease have forgotten their healing power as well. The good news is that, like me, everyone has the ability to reverse their condition and live in such a way to have your genes gift you with abundant health. I'm not promoting shutting off conventional medicine or treatments, as I do believe that they have a role in saving lives. I'm merely suggesting that we should not forfeit our powerful ability to heal by relying on modern medicine. My mission is to empower you to reclaim your healing power so that you can live a long and healthy life and share your purpose and your gifts with the world. As we work together to promote this new paradigm of health-based empowerment, love, gratitude, purpose, and community, we will change the world. And together, we are health. Thank you.